got to listen to That's Good Crack. Colin, Nick, and Danny were tree maniacs. You got to listen to That's Good Crack. How that sober life got these guys back on track.
How are you doing, everybody? You're very welcome to number 30 of the That's Good Crack podcast. My name is Mick, and I'm very happy to be welcome, as always, with my two good friends, Danny and Colin. How are you doing, boys?
What's the crack, Mick? Good to see you, brother.
Yeah,
good to see you, man.
You too, lads. For any new listeners, this is just three Irish lads and our experience of living drug and alcohol free. We are doing a lot more of these lately because we have a lot more time now. We're in lockdown, and we've been trying out some new ideas, and we kind of said that we might look at getting some professionals on, just to see about how things are happening out there in society and what they've kind of noticed themselves. And we decided to bring on a Dr. Colin O'Driscol, and he is the founder of Change Psychology Services. He's clinically practicing in the HSE Midwest Drug and Alcohol Services. And today we're very, very happy to have on board Dr. Colin O'Driscol.
He's coming on now.
So, Dr. Colin O'Driscol, you're very welcome to That's Good Crack. How are you keeping?
Hi, lads. I'm very good.
Colin.
How are you?
We always have to ask, did you enjoy the That's Good Crack green room?
I did. I was socially isolating in there. And
very good. Yeah, everything's been sterilized. You're cool.
Don't worry about the bill.
It's all on us, man. It's all on us.
Yeah. So, Doctor, we're really happy for you to come on. We, as a podcast, the general topic is around living life drug and alcohol free, and we had kind of seen some articles and different things, and just through common sense, we're kind of going that with the change in the lockdown and all that type of thing, that there's there has to be an effect on people's psychology, and I won't say especially, but definitely people who are having addiction problems. So we said we'd have on a professional to give that insight and to see how and where the conversation goes. But just to start off, just to kind of give people who don't know, because there may be people that don't even know what a psychologist is, and maybe just a brief description of what you do.
Sure. So a psychologist is somebody really who manages research and treatment around talking therapies. So it's probably most commonly misunderstood as being similar to a psychiatrist, where a psychiatrist would be more medically trained. So that would be a medical doctor that specialises in the pharmacological treatment of psychological problems, where a psychologist would be more in the talking therapy side of things. So where a psychologist would come into the realm of addictions, and addiction psychologist is a term that's not used so much in this country actually, but it would be more internationally, where they specialize in both the research of prevalence and the nature of addiction and the mechanisms involved in the development of addiction from a psychological point of view, as well as the treatment of addiction and what particular treatment mechanisms tend to be more effective in helping people make changes where addiction comes into play. So you tend to find psychologists in different places. You'll find them in universities, you'll find them in training centres, you'll find them kind of teaching people about mechanisms associated with addiction, as it's addiction we're talking about today, but also psychology in general, psychotherapy, counselling skills, and that type of thing. And then you'll also find psychologists in research roles. So a lot of the research that we would find around these things that we're looking at today would often have a psychologist there in the background in some guise. And then you'll find psychologists in treatment. So they'll be in treatment centres, either working as independent practitioners or working within the HSE or working within residential treatment centres, community-based treatment centres, facilitating one-to-one therapy, group therapy, what is now today video therapy most commonly. So you'll see psychologists probably popping up, and it depends on the particular career trajectory that an individual psychologist has taken as to where they'll end up.
Very good. And you know, I have read one of the kind of things is that you interpret and record how individuals relate to one another and their environments. And like, how have you, like, I suppose before the lockdown, what ways did you do that with, say, you know, someone that would be coming to you and you'd be going, like, you know what I mean? How would you assess whether somebody had a problem with addiction, or say, you know, because there can be, now this is just my understanding of it. I'm not saying clinically or anything like that, you know, how you would term it, but, you know, there's kind of problem, say, drinkers or users and things like that, you know, they can be there for a period of time. And then there's people who are, you know, they're addicts, you know what I mean? They have serious issues that they need to address. And like, I'd be interested to know, of, like, you know what I mean, do you have a distinction, or, you know what I mean, it must, I suppose it's a little bit of a fluid line when you get to a certain point, but like, do you kind of have a definition that you would stand over to kind of go, it's gone from being a problem to, like, whatever you want to term it, but like what I class as addiction?
Yeah. There's probably two answers to that, Nick. I mean, one is the kind of clinical definition, as you mentioned. So we would use the DSM-4 or the DSM-5 today, which is the Clinical Diagnostic and Statistics Manual. So that kind of creates the cutoffs as to whether somebody fits into the category of struggling with clinical depression or chronic anxiety or substance and alcohol misuse disorder and those types of things. Usually the kind of cutoffs that we look at clinically is tolerance and withdrawal. So where somebody engages in a particular behavior, whether it's engaging with the substance or alcohol, or whether it's a particular process or a particular behavior, such as screens, which we're seeing a lot of today with young people, given the lockdown circumstances. When a particular amount may have produced the level of satisfaction, and that amount doesn't suffice anymore, and they need to do more of it in order to be able to get the same level of satisfaction, that's what we consider to be tolerance. So somebody is developing tolerance. So the very typical example with alcohol is where somebody might drink 4 pints when they went out, you know, a year later it's 5 pints, a year later it's 6, it's 7, it's 8, it's 9, it's 10, it's 15, before they can feel satisfied that they've had enough. And then there's the withdrawal. So if somebody stops engaging in the behavior, and we find that withdrawal with process addictions or behavior addictions can be every bit as severe as withdrawal from a psychological perspective, at least, from withdrawal from addictive substances. So they're kind of two key features we tend to look at from a clinical point of view. I would suggest, though, Mick, I tend to try and take a more common sense approach to it. I think if somebody is presenting to me and they're saying, I have an issue with this particular thing, I tend to try not to get too caught up in whether this fits into the diagnostic criteria or not. People are often people are kind of dragged in by family members, and the family members are saying, well, this person is an alcoholic, or this person has this particular addiction, and they're denying it and that type of thing. I think if we get caught up in that battle too much, we miss being able to be helpful to the individual. And I think what we need to do is ascertain, is this particular process interfering with something that's important to the individual themselves? And if that's the case, whether it fits into a diagnostic category or not, it probably clinically shouldn't matter so much, because what we want to try and help them with is making their quality of life better. And if something is starting to interfere with that they're concerned with, well, then we can help them to make changes around that. So you might have an assessment tool that says, you know, if you score 130, you are an addict. But if you score 129, you're fine. You know, you don't have to worry about it.
I done one of those tests years ago.
Oh yeah.
I'd say about
he aced it, A+.
Oh yeah.
They rang an ambulance for me.
That's 132 then.
Oh, but I remember doing that. Yeah. When I was a kid, or a young adult.
Yeah.
I understand.
I mean, really, we clinically, we really obsess with these things. It gives us kind of validity. It gives us a sense of we're right, and people often come with that very question, and they want that question answered, or families want that question answered, but it's not necessarily that helpful, I would suggest.
And would you feel, because I've seen this in other areas now, I can't, I wouldn't know of your field, but like other people that would be involved in addiction services, and you know, that a managerial kind of system can be applied to it in a way, and there's kind of assessment you have to do, and meeting criteria and all these different things, you know what I mean? And it can be, you know, that a lot of the time that it's like that there's a checklist almost, or something has to fit into a certain criteria, and you have to, where that, as you're saying, that like, especially with something like this, it's it must be like virtually impossible to really try and fit people into those boxes, you know, because it seems like, you know, well, again, it's only from my own experience and what I've seen, that like when it comes to addiction, oftentimes it can be one of those things that there's almost like a switch happens where you have a person who isn't willing, you know what I mean, and then can just be willing, you know, and the whole process changes. But in that lead up to it, it can seem like it can oftentimes seem like a hopeless case, you know what I mean? It can almost feel like, you know what I mean, you're beating your head against the wall here, nothing's going in, nothing's happening, and then all of a sudden it's like a switch kind of goes. But I suppose I'm just, I don't know if I have a question there. It's more so from what I've seen that like oftentimes if people are being kept to a criteria like that of like, this is what box they fit into, and you know, that it can be making the job more difficult, you know. So I liked what you were saying there, that you have that kind of common sense approach to it, you know. And I suppose that comes with time, you know, and that comes with experience, and and just
and often people do want that, and there's a reason for doing assessments, and probably one of the best reasons is that it can actually open up services for people, so it can allow people to access things that they wouldn't otherwise be, for like autistic spectrum conditions, for example. Like if you get over that 100 and whatever it is, then all the doors open up to you that wouldn't have been available to you had you not had that diagnosis. So you can certainly understand from a health systems point of view that there are some advantages in being able to do diagnostics. But the problem is when you have a diagnostic tool, people, including clinicians, more importantly, that tend to view that as an ultimate truth within itself. And it's not. It's every diagnostic, criteria-based diagnostic tool and system is just made up. It's just a group of clinicians that have come together and agreed, well, we feel if this is in and this and this and these three things are met, they probably fit in that category that we understand as being relating to that kind of problem patient, as it were. And then when you do that and people operate using that as a statistic manual to tell them whether people fit into this category or not, they start to think about it as being a reality within itself, and it's not. It's just a measuring stick on which we all fit, wherever we happen to be.
Absolutely.
Yeah.
And I think, I suppose, leading on to the point I think it was actually going to make, was that it's like that where some people have dual, if you want to call it that, diagnosis. So they have addiction, but also they have mental health issues, and that when you're meeting some criteria, and it's like, but it doesn't, a lot of the time, it doesn't feel like the services are linked up. It's almost like you come to a point, and if it's, and I have heard from people who are in the position that this is oftentimes what can happen. And I think a lot of it comes down to funding and stuff like that. And people are just so overwhelmed that if someone meets a different criteria and they can be almost put to another like service, they go there. So it's like, you know, you're dealing with someone, your caseload is absolutely full. I'm not saying you, I mean someone, you know, and whatever, and they have like, they feel overwhelmed by the amount of people on their books for addiction services. And you have people coming in who have genuine mental health issues, but no one knows whether those mental health issues were caused by the drugs, or if they're using the drugs to deal with their mental health issues. And, you know, there's all this going on. But that, it seems some people get lost in the cracks, where it's like you come to a point where it's a mental health issue. They're put onto the mental health, they're assessed, and when they're assessed, they're obviously addicts, and they're put back. You know, that this thing can happen when you're only dealing with those criteria, say, you know. But it does seem tough, you know what I mean? It does seem tough at the minute, because I don't know, it's again, doctor, you'll have to forgive me. I'm only going on conversations, a handful of conversations with people who work in the services and things like that. I don't know, but the sense you get from that and from people that you would come across that's working in the or that are in addiction, is that there's lots of help there and there's lots of people getting help, but it doesn't seem like there's enough there for the volume of need, if you know what I mean. I don't know what way to kind of word it, you know.
And it's definitely it's the ultimate concern. It's an international concern. By the way, you're probably calling me doctor to differentiate me from the other Colin on the call.
Yeah.
But, just call me Colin.
Doc, I'll say Doc. That's a bit it's a problem with specialization, really, in relation to dual diagnosis, where we become the more specialized we become in the particular diagnostic, as we were talking, group that we fit into, and the more expert we become at actually being able to kind of work dynamically with that in an evidence-based way that leads to positive treatment outcomes and that type of thing. We create more groups of professionals, we create more groups of specialisms, and the more specialized we become, we tend to encounter more client presentations with problems that cross over all those boundaries, and then we end up in this problem that you just identified of dual diagnosis, where somebody has a mental health issue and an addiction issue, and they often, and probably a good opportunity for me to say that I'm not speaking on behalf of the HSE here, in my capacity in this interview, and I'm not speaking specifically about the HSE. I'm talking about kind of health systems globally. We're very, very clear that integrated care is the model of choice. This is the gold standard for dual diagnosis treatment. And that means that you have both mental health issues and addiction issues being treated in unison. Whereas a parallel model will be you treat both at the same time, but not necessarily in unison, as kind of within the one entity of the person. And then you have separated care, where it's kind of a sequential process where we kind of identify clinically with our fantastic diagnostic tools, this is addiction first. They need to resolve their addiction to be able to work on their mental health issues, or it's a mental health issue primarily, so they need to get some treatment for that before they can look at their addiction issues. And again, like taking a common sense approach to that, neither of them are accurately true. And because in the vast majority of cases, people are just experiencing both, and probably both are coming from the same source. So it's not that one is causing the other necessarily, it's the both are actually coming probably from trauma or some developmental issue that we can identify. Until we start to think about it and look at it in that way, we're probably limiting how helpful we can be to the person. And the sad reality internationally is exactly as you've described, Mick. Those that are most in need and most vulnerable tend to fall between the cracks, because mental health might view it as, well, this is an addiction concern, go to the addiction service, and the addiction look at it and say, well, we don't have the mental health expertise that's required to be able to be helpful to this person, so we refer back to the mental health team in the community, and the person gets kind of stuck in the middle, spinning. So the most vulnerable person with the most heightened vulnerabilities associated with either issue often ends up with no treatment whatsoever, which is, you know, absolutely a real problem. And we are trying to work on that, and we are trying to address that. But mostly it's coming up with local solutions to it, but the local mental health team and the local addiction team start to work together and try and treat people more in the direction of that integrated care model. But I think just internationally, we have to start seeing, like, the prevalence of addiction within a mental health population is vastly higher than the general population. The prevalence of mental health in an addiction population is vastly higher than the general population. So we just need to move into a system we've been able to consider that this is actually the norm, and dual diagnosis is not an exceptional circumstance, it's the norm. Yeah, no, absolutely. And you know, I can't help but think about, we had a guest on Nuno from Portugal, and he was involved in bringing in the decriminalizing of drugs in Portugal. It was a radical move that worked, you know. And but as we talked to him, and he was explaining how it went about, and he was saying that it was just a really serious problem in the country, a massive drug problem. And it was that bad that the will, people got voted in, politicians, they weren't career politicians, and it was basically to sort this problem out. It needed to be sorted, and the will of the people was behind it, and the will of the politicians who were brought in. And he even explained that, because I was saying that, listen, I could just sense off him that it was a totally alien thing to me, that like these people he was talking about and the action that was being taken, it's just not the way politics works or government. I don't want to get too much into that, but it was just really obvious. And he says, well, to be honest with you, it was like this blip, where it was just this moment in time where it was that the situation was that bad, and people got behind it. But it was the fact that there was this will to actually address and to sort out the situation. It wasn't it was like they got the professionals together, they did all these workshops, and there was no party politics, there was no parish pump, like, oh, you're being light on these people or doing whatever like that. It was like, no, listen, this is a serious situation. What can we do to address it? What's the best case scenario? And it was untested, but it was like an honest shot at it. And they were saying, right, and we are going to throw all our resources at this holistic attack on it. Like, you know what I mean? Where not only are we going to decriminalize drugs, but we're going to increase the help for if you want to go into treatment, the treatment center, the place is going to be there. We're going to increase treatment center places. We're going to give methadone to people that will drive it around on the streets to lower the crime. You know, everything, all the resources were put into it. Everyone came on board with it, and it worked because they were all working in unison. It was this holistic kind of plan. And I shared in that my fear of how it might be play out here in Ireland is that, like, they would take a part of it because they wouldn't have the will to go, we are going to attack this. We're actually going to try and do it. We're not doing it for any other reasons than to sort it out. So they might decriminalize one drug and no extra beds because there's going to be a spike in use. That's what's going to happen. And there's a percentage of those, without doubt, is going to have problems. So it's going to have issues. And if they don't have the safety net for those people, you have exacerbated the problem. You haven't made it better. You know what I mean? So, like, I get what you're saying, and it's like, it frustrates me a little. I'm not going to lie. When you could just tell from him when he was talking about it that there was this will there to sort out the issue, and it ended up being financially better off. It wasn't that it cost this load of money. It was actually because of the policing, the social, the medical bills, like the infection rates went down, the death rates went down, the policing bills went down, the medical bills went down, everything went down. And so, like, you know, I like what you're saying, and I can get it. It seems like such a massive thing, but I think, to be honest with you, if I'm honest, I think that the likes of yourself does have the solution. You actually do know what would work. And unfortunately, I don't believe that the will is actually there in the powers that be to actually implement holistically, you know, and, you know, the what needs to be addressed, you know what I mean, or what needs to be implemented, you know.
Yeah, because there are probably two ways to think about how we can be helpful as clinicians. I mean, one is on an individual basis and how we can help somebody who's struggling with a particular pattern of addiction, and yes, we certainly have an expertise around that. But then there's the social approach to it, and I agree with you. I mean, like, the Portugal model is something that the whole world should sit up and take note of. It's not something that directly maps onto every system, and there are systemic differences in terms of how your social structure is set up in an individual country. So it does need kind of adaptation. I think you're probably right. Unfortunately, we'll be probably take a little bit from it and a little bit from that, and hope to get some similar results. I think those good things will be positive, but could it be more positive? Yeah, absolutely. I think ultimately we have to take a major step, and I think it's an attitudinal change as much as it is a systemic change, and I think that's where a lot of the barriers lie. But I think we have to take a step towards being health-led in how we think about drug use, and to consider it as a health issue, not a criminal justice issue. Because you're right, when people fall into a criminal justice system, not only is it not necessarily the right response for that individual, but it's actually taking them on a journey further away from the prospect of recovery, than being helpful.
No, absolutely. And another thing I was thinking of, and I don't mean to take over here, but just as you're speaking there, I was thinking about this, and I've actually lost my point now, but it was Yeah, it's relating to, yeah, that's it. The will. See, I just think it comes down to, the old saying, where there's a will, there's a way. And that's what I saw with Portugal, right? And I understand, because I look at now, I'm a long time away from that world, but I still, I give people a dig out when I can. So I do have a kind of sense of what's happening out there still.
Sure.
But I understand from the other side of things how the world, see, as I was saying there, that people who are in addiction, oftentimes, like, they're getting help. They're not, it doesn't seem like they're doing anything. They don't want it. They don't want it. They don't want it. They don't want it. They want it. So in society, if you're looking at someone getting help, you're struggling along, paying your taxes, doing whatever you are, living a good life, everything like that, and you see people who are in addiction, you don't know their story, you don't want to know their story, you know what I mean? You're just getting on with your life, but you see them, and like, I'll admit to it, like, you know what I mean, when I was involved in addiction, a part of it is you're self-centered. You are totally consumed by taking care of this issue. You want to get whatever you want to get, that's your goal. So when you're doing that, you are, like, you're self-centered, and people struggle. They look at that and they're going, like, it's hard to look at, you know what I mean, because you can see all these manifestations in this person's life. They don't want help. And so for society, you kind of go, they need to get punished for what they're doing. You know what I mean? They need to get punished for this, like, illegal activity or whatever like that. I hope I'm explaining myself right, but what I'm kind of going is the will of normal everyday people to come on board with a radical approach to dealing with this issue has to come to a point where the problem is that bad that people go, listen, we'll do it.
It becomes intolerable. You have to do something differently.
Yeah. I think one of the things you're trying to say, Mick, is as opposed to looking at a lot of what people are addicts, alcoholics, instead of looking at them as a stain on society, as an issue, but to look at them as people who have an illness, like someone who has diabetes, someone who has this, correct me if I'm wrong, I think that's where you're coming from, is to look and say, hold on, this person's not well, they need help, they need the support of the community, and they need it implemented across the board. And that starts from, within the community, it starts within the laws. And one of the things that really stood out for me with the Portugal model is they didn't just say, right, let's implement this. It was under a big umbrella, supporting people with addiction, carrying it through to the point where they're, going back into life, they're supported there. And I think that's really important. I think one of the hardest things is when you're sick like that, for me anyways, when I go back to myself, I was separated myself from the world. And because of the actions of what I was doing, the things that I was doing within my addiction, people didn't want me near me. They saw me as, this person's a bad person, blah, 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 blah. And they were looking at this as opposed to, okay, we need to overhaul the way we look at addiction and alcoholism as a whole and remove, for want of, I suppose, remove the stigma really of it. I think that's kind of what you were saying, Mick. Am I right in saying?
It was, and the reason I was kind of stumbling over myself was I was trying to express that I do understand from a person who's not involved in this, when they look at this situation and they can feel anger and they can feel frustration and they can go, no, why would you, you know what I mean? I can understand that. But that ultimately, like in the Portugal model, if the will was there, that it would work out better for society. Like, you know what I mean? An awful lot, like you talk about, people falling in between the cracks. Like a lot of the people who are on the streets that may be involved in crime, that maybe, these things are happening until it lands at your door. It's like, it would be far, far greater for society if we could address this in a radical way and actually go, right, and look to make a solution. And ultimately, I believe that, it's financially, it would be better. You know what I mean? It was just all around. But like, Colin, just in that, like, you know what I mean, I suppose in seeing, and we've discussed now a lot of how things have been, have you seen any changes in the world of addiction, say, since this has started? I know it's very early days. Anything that we kind of talk about is almost anecdotal at this stage, but you have this sense that there has to be some negative effects on people from this, that people that are dealing with addiction problems.
Definitely, 100%, and that picture will continue to emerge. But there is no doubt whatsoever that we're going to see some sort of a negative fallout when we think about addiction, but also mental health and a lot of what we're talking about is in the problematic category, so the kind of pathological diagnostic group, but also in the general population. I think the whole unit starts to shift up in potentially in a more problematic direction in circumstances like this, with kind of an imposed isolation, and you know, when we disconnect from our communities, you know, stress levels go up, depression goes up from whatever starting point it's at, but it tends to creep up. And unless people take a kind of a pragmatic approach, which we might talk about later on, but it's kind of a system, well, this is how I'm going to manage this, this is how I'm going to do it. Yeah, there's a risk there for all of us. And yeah, addiction is certainly no exception to that. We have seen, and we will continue to see changes there. The loss of structure, the being within the four walls of the house for a greater period of every day with the same people. If you haven't got mechanisms to be able to deal with boredom, and you drink, reaching out for the drink more frequently is going to be a very common response to the situation. If you have an alcohol-related problem, the amount that you reach out for drink is going to become more problematic. There are certain social controls associated with being able to, you know, go to the pub and drink your certain amount of alcohol there, and everything is in standard measures and that kind of thing. So it's not totally dissimilar to the smoking ban, but it's going to push more, and you know, the changes of behaviour around drink driving and so on. It's going to push more people to drinking within the house, but now in a very extreme way, because not only are people not going to the pub, they're literally not leaving the house, other than to do their 2K bit of exercise and their shopping. And you know, you can see it in the supermarkets. You can see the what the trolleys look like. There's not a whole lot of food in there often.
No.
I would imagine that's a lot of people's releases, those trip to the pubs every week or whatever it is, you know?
Yeah.
Release. And I mean, I know, I think I'm not exact sure on the dates now, but I'm pretty sure I'm in my 5th week. From what date they closed down the schools in Ireland, that's when I've been sitting on my couch, like, you know, that's how long I have been. So I'm sure most people are like that, you know, most people haven't. And it's a long time. It's a long time. I was thinking about it yesterday, like, there's, from friends and that I've spoke to, a lot anxiety levels are out through the roof. And I suppose if you have anxiety and you don't actually realize what it is, you know, whereas I would know what it is, you know, because I would have had it bad at periods of my life, but not so much anymore. But I know what it is, and I know how to deal with it without alcohol or drugs or whatever.
Yeah.
I would imagine that drug intake and alcohol levels or abuse are gone out through the roof in the past while. Even with that, I was freaked out for 2 weeks, man. Every day, if I got a sore throat, watching Facebook feeds all day long, posting shit, fighting the system, thinking about it, getting angry, you know, then getting sad. All these range of emotions, man. It was fucking mental for 2 weeks. Now I don't care. You know, like I wash my
stages of grief.
That's exactly it. It's grief.
That's exactly what it was. Stages of grief. And then just being, and now it's just like, I actually don't care. I don't care. All
Acceptance.
Level of acceptance, where it was like, I've said this in the last few podcasts. I worked on ships for a few years, you know, and the ships now that are actually in a lot of trouble, you know, with Australia, places like that, those companies, I would have done work with them as well. Battling infectious diseases. Now they're not as severe as this one, but gastro and stuff like that. The only way to ever battle it was wash your hands. You know, there's nothing else really you can do. You know, and I've just adopted that policy, and I say that to people: you don't put your hand, you can't really get it. It's different, I suppose. But yeah, so that was my point. Is I experienced some levels of anxiety over this, and I could imagine if I was drinking at home and stuff like that, because one thing that really fascinates me and concerns me a lot, actually, and I think about it quite a lot, is that grey area that people are stuck in. There's this massive, I'm sure you've witnessed that, where their life isn't bad enough, they still have money, they're still working, but it's fucking, drinking is killing them slowly. And if it's not killing them, it's fucking their life up. Sorry, excuse my language. I need to stop because Google are pulling. Google, stop swearing because Google aren't allowed us promote our podcast.
They call us shocking content because of Colin's language.
Here, look, our time was bad, so.
Stop with Colin.
Oh yeah, not Doc. where there's, but
yeah,
yeah, but it's like Colin was saying there, that's exactly it. Like, you know what I mean, we speak a lot to the people, say they might be the problem drinker, the problem user, you know what I mean, and try to give a bit of our experience of living this life. And you know what I mean, that if you're looking to kind of curb it a little, you know what I mean, that, but with this I could see, and I don't know if you have any insights, doctor, maybe like some telltale signs for people if they were just, because listen, at the end of the day, the reason why we didn't go down the line with the podcast, a lot of the thing was going for the hardcore addict, or really talking to that, because at the end of the day, it's like not a podcast you need to be coming to for that, you know what I mean, you need to be going to people like yourself, or you know what I mean, and it's like, it's a lot more easy to see the likes of an addicts, you know what I mean, if you have that type of problem, like you have a type of problem. But if it's a problem kind of stuff, and it's not wanting to escalate in these unusual circumstances, do you have any kind of, you know, insights or things to say to people of how to kind of maybe assess it or address it? I don't know.
Yeah, I think like exactly what Colin was saying is a very good example of where somebody might escalate and increase their alcohol use almost unbeknownst to themselves. And that's where you're experiencing anxiety. So for example, if you're somebody who had, you know, a glass of wine a few times a week with your meal and that kind of thing, that's one thing very much within normal range and kind of low risk drinking and so on. But if you find that because of this circumstance now you're experiencing a little bit more anxiety and you're kind of noticing that actually that glass of wine is helping with that, that's kind of medicating, because that's the problem, it actually works.
Sleep as well. A lot of people use it.
Say again?
A lot of people use it in that situation for sleep.
They do, absolutely. A glass
of wine turns into a bottle and a half at times, like, and that's just when people spoke to, you know.
Yeah, and so that's one of the things to definitely watch out for. If you're using alcohol to medicate your psychological experience or your emotional well-being, then you're putting yourself on a slightly different track. And it's not necessarily saying that the level that you're drinking at is problematic now, but you're probably on track in that direction. If you're drinking in that particular way. So I would generally advise people, if they notice that they're drinking to manage anxiety, find a way to manage your anxiety first and then pick up your drink. So for example, if you're experiencing anxiety, meditate or use some mindfulness-based techniques and get yourself to a place where you feel more emotionally stable, then have your glass of wine. So it's the glass of wine isn't the solution to the emotional dysfunction, if you like, which we all experience, of course. So there's some telltale signs. The same with low mood. You know, in these circumstances, people find themselves trapped in their house. It's frustrating, like a little bit of novelty at the start, but that's all kind of long gone now, and people are just kind of craving social engagement and craving outdoors and craving activity, and they're not getting it. And you know, the result of that could be a lowering mood, and people may discover that glass of wine actually helps to kind of nullify that to a certain extent, or numb that experience. Same thing again. If you're feeling that,
it makes you feel good. It makes you feel good. It's just
it has that kind of tonic sense of well-being, and again, it just puts you on a slightly different track. You're changing your relationship with the alcohol.
Absolutely, yeah.
And that just takes you in a different direction. And it's something that all people should be mindful of anyway, but particularly at times like this, because I think what we're going to find is there's a lot of people who unknowingly are going to start to put themselves on that track, and that track might continue.
A big question for me. Sorry, Colin.
No, go on, continue.
It was a big question for me, Colin, was, you know, obviously at this time, well, for me personally as well, I go through bouts of, Colin touched on it there, and about anxiety. I go through bouts of fear. Obviously, the situation where, you know, in my case, I can't work. I have no money coming in. I've bills going out. There's so many situations that have just at a moment have changed in my life. And I have mechanisms that I use to deal with them. Sometimes I don't use them very well, and I get full of anger, hurt, you know, different things go on. And I suppose the question I have to ask for you in your professional capacity, what kind of would you recommend to people like ourselves and people who listen to our podcast that could help them in moments that I know you touched on meditation and mindfulness, which is two really things that I try and use in my life as well. Meditation massively every day, and mindfulness, bringing it back to the moment and what's happening right now. Would there be other things that you might suggest for people that are listening to this now to help them through these times, you know?
Yeah, like without veering into kind of career advice, yeah, like absolutely, because there is a harsh reality to this, Danny, and it's exactly as you described. There's so many people who just, you know, financially things have just become very unpredictable very, very quickly, and as well as a loss of structure, now there's a loss of security as well. And for many people, we didn't realize how much we relied on that security until it was kind of pulled away from us. And that can be very upsetting. It can be the other things we spoke about. It can lead to a significant increase in anxiety, unpredictability or insecurity of the future, kind of a depressed mood, feeling kind of locked in, feeling the loss of agency or an ability to have any control over what might happen next, because there's just a bigger picture outside the door which we don't have any control of. But you know, at the same time, the reality is that will be here. We'll be here tomorrow, and it's going to be the same situation. So what is it that we can do with this time in order to try and create something positive that maybe offsets some of that kind of negative emotional experience? And like I said, I mean, mindfulness. I would hugely recommend mindfulness. I think everybody should be doing mindfulness anyway. You know, you can only benefit from it. But absolutely, if you're struggling with any levels of anxiety or depression, I mean, mindfulness it should be the first place that you go to. The evidence for it is profound. It's super clear. Probably trumps all the other treatments that we talk about for these diagnostic groupings. So it's really, really well worth a look, and very simple to do. But other things like structuring your day, I think, you know, waking up and kind of having a sense that this is what I'm going to do today. It should involve definitely some sort of physical activity or some physical outlet, whether that means that you have a wall to kick a ball up against, or whether you walk within your kind of 2 kilometer radius and you do it kind of 4 times, or depending on what your level of fitness is and that type of thing. But absolutely being outdoors. You know, I talk to clients about maybe trying to take up something new, and take up, if you're not a reader, start reading. You know, find a good book and read it. If one of those things that you kind of had on your bucket list for years was, I would love to learn how to play the guitar. Well, I don't know how you would get a guitar today, but if you had a guitar in the house, or if somebody could loan you a guitar, with social distancing, etc., etc. But you know, to YouTube it, try and, rather than watching the other stuff on YouTube, you know, pick up a new language or learn a new skill. Or say again?
I was smashing conspiracy theories over it all day long. It sounds way more healthier to me, so I prefer your suggestions.
Can't a bit of conspiracy smashing either, though. Productive.
No, rabbit hole.
Yeah.
Yeah.
But yeah, no, that definitely. I mean, one of the things is we had on the recent podcast with John Gibbons, was one of the things he really talked about was making a list. And I found last week I was kind of tumbling over myself, and kind of, in a way that, I mean, mentally, and kind of feeling like I was in a boat without oars, if that makes sense, and kind of just feeling like I've no direction. I didn't feel drive in my life anymore. I just felt like, sure, what's the point? Because I don't even know what's happening tomorrow. I don't know what's happening in 2 weeks. And I said, right, Monday morning this week, I got up and I wrote a list of exactly what I was going to do that day, things that I wanted to get done. And this is the way I'm going to structure my week. I'm going to have a weekend, like have a day off and just chill and watch it. But on the other days, I'm going to actually get stuff done. You know what I mean? And I found, along with obviously the physical exercise, and I'm living in Tenerife, so it's slightly different. We can't go outside. We don't get 2 kilometers. We don't get any distance. Okay. So what I have been doing is doing the exercise in the house every morning, which is super. Yeah. And I agree, it changes my mentality. And the day I don't do that, I don't get the reward. So I found, those suggestions really good, and the meditation, but it's when I was not doing that stuff last week, I found I was getting annoyed with everyone, like the lads here, we talk in a WhatsApp group. I was finding myself getting wound up with that. Just things that, but maybe 3 months ago, wouldn't have even noticed, you know what I mean? But then I was like, even my family, like sending me messages, I was like, why is he saying that? You know what I mean? And it's because I wasn't on a structured path, you know what I mean? And it was, honestly, I was getting thick with everything. Like, that's the truth, My head wasn't there, And I find it coming back and forth now and again, but it's that trying to bring it back to the moment. As you said, tomorrow I'm going to be here. What can I do with now? Accept the situation and try and just, just chill out and not get so wound up and have the structure in my life. You know what I mean? So, because I can find myself going down so many rabbit holes in my heads like this,
So doing something simple and structured, like you say, making a list. I'm going to do this for this hour, and I'm going to have my weekends, and I'm going to have my weekdays, and this is what I'm going to do. I'm going to have some physical exertion within the space. Really made a big difference.
Big time, made massive difference. So would definitely recommend those things,
Danny is our resident Dalai Lama around the meditating and stuff, but we can say actually today that like the three of us though, Colin, have taken up meditation.
Well done, Colin.
We're at daily now, thank God.
I was late to the party, but then they
the meditation party.
They mentioned that they kind of make more money out of doing it and stuff, so I was he said to me, it was like about, getting more work and getting more money, and Mick said you can do it in bed, so I was like, right, that's it. I'm in.
But like,
and in bed at the same time, so I was like, yeah, I'll do that.
But like that, it's another thing just to say, and I've talked about an awful lot. If things are getting on top of me, Colin, I start journaling. I do 3 pages of writing, and it's just such a powerful tool. If anyone feels overwhelmed, like there's what I find is there's just so much. It's like white noise goes on in my head. I don't even know it's there. It's all these mumbo jumbo to-do lists, things that and when I do journaling, I just clears it all out. And, as I'm going along, I'll underline things that I have to do, you know what I mean? And then afterwards, I'll put that into a to-do list and I'll do whatever. But it's just, for me, for years, I wasn't able to meditate. I found it very difficult to consistently sit down and have that quiet time because I'm up quite early in the morning to go to work. This is my excuse, by the way. And I'd have to be up very early and I wouldn't consistently do it. But with the journaling, I found that because I could pick up a pen, I could put it and I could write, that I found I did that a lot more often, and I was able to continue to do that. But like Colin said, the thing about the lockdown, I do try to have a structure. I go to bed a little bit later, I get up a little bit later, but still around the same time every day. And but in bed, wake up, meditation, have me coffee, and I could do some Wim Hof breathing, I could do some journaling, I could do some, whatever, learn something on YouTube. But I find that's just a fantastic thing, especially with anxiety, if I'm feeling overwhelmed, any of those types of things, that cathartic kind of process of actually getting it down on paper. There's something about, a person said to me years ago, he says, Mick, treat your head like the Bronx, don't go in there alone. And it's like, that's because I used to overthink. I used to try to sort the world out in my mind, and I had so many things going against me. I had so many beliefs and different things that were just wrong, and this was the hardware that I was working with. And by journaling, by discussion, like talking to people like yourself, it's a completely different thing, and for anyone that is going through tough times, that if you can find someone like yourself or someone with the experience of going through it, that can listen, and not even so much give advice or whatever it may be, but just actually, when you have your thoughts are over, this has been my experience. When my thoughts are at me, I've been feeling overwhelmed, I can convince myself of anything, literally anything. If I want to say a 7-foot tall green monster with a tentacle out the back of his head, as I'm saying those things, I can make it up in my head, even though I've never seen one before. You can literally convince yourself in your mind. But if I say it to somebody else, or if I write it down, I almost have to be accountable to my thoughts. There has to be something to them. You know what I mean? I can't convince myself of these horrible, things. And it's just a totally different thing. And just to shut your mind off, to actually, when for those little moments in the meditation where you can actually just, stop thinking, and it might only be a glimpse, it might only be a little tiny moment where you actually aren't thinking of, what you're going to be doing next or what happened yesterday or whatever maybe. But it's from the time before I do that and afterwards, there's a marked change, and it's brilliant,
It's really good advice to anybody listening.
I just want to jump in on that one. I know I kind of said it lightheartedly about the meditation, but I have found it invaluable. Especially I noticed there one day where during lockdown, and I swear I don't do this normally, but I found myself having a little nap during the day. But there's something about that. We've spoken about this before, about that nap during the day. When you wake up, absolutely, my head is melted. You know what I mean? Like it does more bad than good a lot of the time. You know? Well, and I found meditating after that, when I'm feeling like that, it works. 15 minutes after, gone. Everything's gone. I'm back
like that idea.
In a good space, and it's the same. Like meditation would have been a big part of when I came into this lifestyle first, of living drug and alcohol free. Like meditation, where we used to meditate every single day, twice a day, you know, and it's a struggle. It's a struggle. Like when I think of Mick meditating now, because he's been doing it for a while, I think he's sitting there all chilled and everything is going perfect. But the reality of it is, you're probably having to keep yourself in check. You know, it's just the way it goes. Like there's no perfection to it. Like, but what I have found is that the little tools and that it's given me in the morning with that guided kind of thing, it helps me recenter. My head is going adrift, man. My head is crazy a lot of the time. Not crazy. I'm a very creative person, so my mind is always gone. So. But I have found that is a very, very, very good. There's one thing I wanted to circle back there, actually, was I was going to get, because I think it could be kind of useful information for people, was Mick said the other day, and it's, you would know this as well, it takes 28 days to form or break a habit. So it's that whole thing of like where you're having the extra glass of wine or smoking some extra weed or whatever it is people do it like at home during lockdown, and that is, and you think, oh, I'll stop it. I'm just doing it for now. Yeah, I won't do that once it goes back. But it's a very tricky game to play, isn't it? Once lockdown is finished, it's a very tricky game to play where saying, you know, like if you're having a couple extra glasses of wine in the evening or smoking extra weed or whatever it is, to actually say that after lockdown, I'm only doing it for lockdown. But as Mick said, the 28 days to form or break a habit, like it could actually form into a habit to continue on after that. I mean, I think that's a very tricky situation to start playing with, you know.
Absolutely. I mean, if you ask anybody who's developed, an addictive pattern and something that they needed to put quite a lot of attention to in order to be able to change, they can often track back to events. I mean, sometimes there are very traumatic events of very, very extreme situations that lead to an extreme change in behavior, but probably more often than not, there's been a series of changes in the development of that addictive problem. And often you'll hear those kinds of things spoken about. Well, there was this situation, you know, where after such and such died, and I just started to drink more, it kind of got me through that. And that really changed my relationship with drinking, and it kind of set me on that track. And that's the risk, Colin, that this is the time where that will happen for people. Like you say, I mean, I think you said it was 5 weeks at the start of this meeting.
I think so, yeah.
You know, that's more than 28 days. And, you know, 28 days, there is something around that period of time where something becomes established. The same with changing in a positive direction. So if you want to stop doing something, it takes a lot of effort for the first few days, and usually something around kind of 3 to 4 weeks. And it doesn't require that daily moment-to-moment attention. It's something that kind of sustains itself a little bit more, just requiring your diligence to keep on top of anything that kind of spikes back up. But yeah, that's the risk, that people will kind of justify this change, and it's just during this kind of lockdown period, and then suddenly, you know, 2 months later, they have a very kind of cast iron developed new way of being that doesn't just change back.
No, it doesn't just
we had also said that, Colin, that like in the same way that, yes, you could be developing a habit, you could also be breaking one during this lockdown. You could be taking,
it's a really good point.
It's like you have a really busy life, like, you know, I mean, you have people there, man, right? They're dragging their kids out of bed in the morning. I'm just giving you a hypothetical here, but I've seen it. You know, you're up at the crack of dawn, you're getting your kids up out of the thing, they're upset, you're putting them into the car, you're driving them to the nursery, you're heading up for an hour's drive to work. You know, you're stuck in traffic on the way home. You get in, you cook the dinner, you get the kids to bed, and then it's just sit down and, just have a glass of wine. And next minute you might have 2 glasses of wine or like that. But now you're at home, you maybe started running again, you know what I mean? You're spending time with your kids, you're doing whatever. No, I'm not trying to give the Disneyland version of it, but listen, you know, there is that going on. People are actually reconnecting with their life and their family in a way that they haven't done in ages. So, you know, it doesn't all have to be like, oh yeah, I'm heading for the whiskey, you know what I mean? It's like, it could be a thing where like, hey, do you know what? Is that really helping me? I'm feeling that little bit groggy in the mornings. It's making actually those early mornings a little bit more difficult to get up and to do that, you know what I mean? Because, you know, if you've had that little bit, I'm not saying, like, but like, you know, it's a fairly standard thing for people to be having 3/4 of a bottle of wine at night now. And it's like, you get used to it, you know, you get used to that morning kind of, not, you know, but it's just you feel it as part of the course. But I do believe there's opportunities, and I do believe a lot of people are taking it where they're saying, do you know what, do I really need this? Do you know, is it really adding anything to my life? You know what I mean? I have friends personally who have taken this tax, you know what I mean, and they have started to address it, you know what I mean? But and they wouldn't, like, you wouldn't say they even are problem drinkers, you know, but it's just something that they feel they could address. I think it's fantastic. I think in this, I've used this this time, because a busy guy like the lads, I'm sure yourself, Colin, I've used this time to be creative, like I'm doing music again. I like, I mean, I hadn't done music in a long time, and I'm being creative around that. And I just opened the stuff, you know, doing the podcast here and being able to put more work into that, you know, and anything I've been asked to get involved in, I was like, yeah, you know, great. So, and on a personal level, and I know I've said it before, if I was back in those days, I most definitely would not be doing that. So it's like,
it's a really important point, and I think it was exactly as I say. We very much kind of focused on all the bad things that can happen, but there's huge opportunity at a time like this. You know, connecting with loved ones on a slightly deeper level. Like I say, like getting back to running, something that we didn't have time to do anymore. Sorry, Danny, I know that's not.
I can run on the spot. I've been running on the spot.
Yeah, burpees, yeah. But things like that, like, I mean, when have we had the opportunity where we could do like 4 15-minute fitness sessions at home without having to worry about what we look like after it or having to get changed and that kind of thing? So there's real opportunities in terms of picking up areas of our lives that we've let go of. Even connecting with people, you know, picking up the phone and calling somebody from the States that we haven't spoken to in a long time, and you know, all those kind of things. That this kind of represents headspace opportunities to start engaging in those things again, and that when we're very busy on a day-to-day basis, we just don't have the opportunity to do.
Fantastic. Well, I think that's a nice positive note to finish on. You know, Colin, thanks so much for coming on. You know, some insightful stuff, and it's just great to get things from a professional's point of view. And just to realize that some of the stuff we've been actually saying to people to do, we can actually stand over now. We could say, no, he said, Doc says it's sound, you know what I mean? It's, yeah. So that's kind of legitimizing some of our BS. I know, but like, listen,
that's what I do.
But no, again, listen, wish you all the best for this. Hopefully life will be getting back to whatever we were going to call normal at that stage. And what you call it, if it does, if there's ever another thing that comes up, or you want to come on yourself, give us a shout if there's anything you'd like to talk to us about. But is there anything else you'd like to finish up, or before we go?
The only thing I'll be tempted to say, it probably won't be finishing on the positive note that you were hoping for. But
that's okay. That's okay.
Just one thing that we probably didn't speak about, and it might be worth mentioning, is in more of the problematic drug using population. One of the real risks out there. Firstly, it's a group of people that have a higher incidence of pulmonary diseases and cardiovascular diseases and compromised immune systems. So they're a higher risk group. And the drug-seeking behavior tends to put them at higher risk again in terms of contracting COVID-19, because just the sharing of joints, sharing of needles, sharing of paraphernalia, vaping, even, you know, and even actually buying drugs and that type of thing. It's, you know, you're not maintaining your 2-meter distance, and you're kind of very much in each other's faces and in doorways and that type of thing. So it is a higher risk group. So I think anything that we can do to support people in that context, the better. not only that, I think it's probably an important message to get out there as well, that when people overdose on heroin, it's what actually causes the overdose is a respiratory condition that's actually stopping of breathing. And if you throw COVID-19 into that mix as well, it's very, very dangerous, and the likelihood of overdose increases slightly. So it's a vulnerable population. It's a population that is worthy of our compassion, or understanding, or empathy. And they're very exposed in this situation. And again, I think anything that we can be doing to help them should be really reinforced.
Well, because I see a lot of drug addicts and drug users on the streets that I would have known. I see them now. Even I had to go to the post office today, and I've seen. Yeah. That's all you really see a lot of time, is people with drug issues or that on the streets, or drinkers, like street drinkers and stuff like that. But when they support them, like, what do you suggest? What do you mean when you say that? Like, when you say support, because it's not easy to support someone in that situation,
sure.
For a myriad of reasons,
Yeah.
So I would be curious to see what you actually define as support for people in that situation.
Yeah, I mean, and that is difficult, Colin, especially without putting yourselves at risk.
In a heartbeat if you went, like, and I don't mean that in a bad way. I know what it's like to be there. I know, you know what I mean. It's not as simple as going over and saying, oh, you know what, or here's some money, come stay with me, or it's a very tricky situation. That's why I was curious to understand what you meant there.
Yeah. I think, well, in the first instance, I think, sadly, what people who fall into that category experience the most from society is prejudice, and it's exactly the opposite of what is helpful. Now, I'm not suggesting that we all start to walk over and engage with people that we haven't engaged with before in what could be perceived as a threatening manner, but at the same time, there are drug and alcohol services in the community. There's HSE services, there's HSE funded services, the community and voluntary sector services. And that help is still there, and it is still available to people. And there are services that are set up and have thought about in a very structured and planned way how we're actually going to deal with being able to still have an outreach facility to people who are either homeless or using or dealing on the streets and that type of thing. So we've thought very carefully about how we actually take that step, maintain safety ourselves from an illness point of view, but also still provide a structured service. So I would suggest that if that message can be given to anybody that anybody knows who is engaging in these very kind of risky situations and they're already part of a vulnerable group of the population, anything that can be given to them by way of, here's a phone number, here's a service, here's the details. I think that's because there's a sense that everything is closed down, but from a health point of view, it's not.
No, and also just to say to people that 12-step recovery groups are online as well now, and if you look them up if you want to suggest it to people or yourself, you want to avail of them, that they are still going ahead.
They're actually running more often now, I think, aren't they? There's so many of them now, and so easier to get them. Is there any kind of places you would suggest to go where people can seek help, a website or anything like that, what we might be able to pass on the details?
Drugs.ie is the go-to place. It has the repertoire of all services across the country, phone numbers, websites, email addresses. So Drugs.ie is definitely a place for alcohol and drug services.
Super.
Brilliant.
Yeah.
And we were going to finish up a long time ago, and I know you have to go, Colin, but just one more thing that we don't have expertise in or knowledge really of, but that we know has become an issue, is around domestic abuse, which has just using common sense, you could understand that people are around each other a lot more often now under these circumstances. And I think you might have some insights. And just again, if there was people who are experiencing domestic abuse, that maybe we mightn't have time to get into it in great detail now, but would you have just advice or maybe where people could go to if they're experiencing it or if they know of someone who is experiencing?
Yeah, well, there's the Women's Aid National Helpline. I think that's definitely a go-to. And then there's local services within your community. It is the absolute sad truth and reality of this circumstances that there's a significant increase in domestic violence. and the victims of domestic violence are probably more exposed now than they've ever been, because the country around them is in broad shutdown. So and obviously the services that are providing services are in high demand as well, so they're kind of stretched as well. But I would absolutely encourage people to reach out to their local services that are available to them and the national helplines around domestic violence. The national helplines absolutely have their finger on the pulse of what services are available within their local region. They won't just give you information and kind of hope that you're going to do okay with that. They will follow up with you. They will stay on top of things. They will try and support you in any way they can. And if that means that you can't get to a residential refuge or a facility, it might mean that you get the support of family members who can come and rescue you, or you can get the service of the Gardaí who can come and put in kind of safety orders in place and that type of thing. And the Gardaí are very responsive. This is probably mostly what Gardaí are doing at the moment, is responding to domestic violence calls. Wow. So everybody is kind of switched on in that regard. But if the victim doesn't pick up the phone and reach out to anybody, it leaves them in a very vulnerable situation. And I know and I understand that isn't always possible, and it's not always easy to do that, because there can be kind of a very kind of strict surveillance of the victim in these circumstances within the four walls. But at the same time, look to Gardaí, look to the Women's Aid, look to local services, look to family members that can reach out and support you and maybe get you out of a very dangerous situation.
I know they introduced here in Tenerife anyways, I'm not sure if it's the whole of Spain, but like a code word that you can use if you go into the pharmacy to say to the person behind the counter, and it's recognized here on the island for anyone that's experiencing domestic abuse, that they can go up, say it at the counter, and then the police will be contacted in relation to that. Like, so, and that's been activated on here on the island, apparently, according to the local news on a regular basis, which is,
brilliant idea.
So yeah, it's definitely, I thought it was a good idea in the sense that, because obviously, as you said, very hard to kind of make contact when you're in a house and you can't leave the house and you're under surveillance from that other person,
Yeah.
And for men experiencing the same situation, because obviously there's the other way as well, where could men reach out for help?
Oh, the same. I mean, all the same domestic violence services are available to men as well. And if for any reason they happen to come across one facility that isn't, still find the one that is for you. So absolutely use the same helpline numbers, use the Gardaí, and just exactly the same. Yeah.
Excellent.
Yeah. Thanks a million, Colin. Well, listen, we've taken up enough of your time, and again, really appreciate.
Thanks very much.
And we hopefully we'll get to talk to you again sometime in the future under better circumstances.
Yeah.
And so just have a good lockdown, and we'll talk to you again soon. Take care, folks.
You guys too. Thanks very much.
Thank you very much.
Peace.
All the best.
Peace out.